Back to my channel. My name is Rebecca. Remember to like and subscribe. So today I'm going to be talking about common mistakes and errors that can occur during OSCE. So OSCE consists of 6 stations. First 4 would be scenario based and the last 2 would be clinical skills. Now, for all the OSCE stations, the common mistakes and errors are lack of communication. So although you are not dealing with a real patient, that patient, a mannequin, would be listening and talking back to you. So it's important to use your verbal and non-verbal and listening skills. Another thing is not reading the scenario or instructions accurately. Not completing your paperwork and assessment within the time frame. Touching the patient before conducting hand hygiene techniques can go against you. Not checking for allergies. So every patient who has an allergy would have a red allergy band, but it's important you ask your patient whether they have any allergies. You need to check patient's ID as well by confirming their names, their date of birth, and how they would prefer you to call them or refer to them. Not gaining consent from a patient can go against you. Not ensuring patient safety can go against you, and not completing your station within the required time frame. So you have to be on time. Now, during the scenarios, you're going to be assessed on nursing assessment, planning, nursing implementation, and evaluation. So during the nursing assessment stage, some of the common errors are not completing the vital signs accurately, not completing your documentation adequately. Now, during the planning stage, some of the things that can go wrong or some of the common mistakes are you not writing the evaluation date within the prescribed time frame, incomplete documentation, not considering self-care element for your patient, your writing not being clear enough, not recognizing abbreviations, and not dealing with errors accurately. Now, during the implementation stage, some of the common errors are not checking the expiry date of medication. It's important you check the drug expiry before you administer. Not reading the medication chart properly can go against you. Overdosing or underdosing the patient, and signing for medication before administration. It is important that when you're going to give an injection or give a tablet, you make sure the patient takes it or you have administered that injection before you sign. Now, during the evaluation stage, some of the things that can go wrong are you not writing the reason for admission and the date and time of admission, your writing not clear enough, abbreviations not recognized, and errors not dealt with correctly. And during the clinical skills assessment, some of the common mistakes are contamination of sterile fields. So if you're doing CPR, chest compressions are not deep enough, or they are too slow, or they are too fast. Chest compressions are not timely because they have to be timed. Discarding ampules prior to administering of medication. So if you're going to be giving a medication, either IV or intramuscular, you make sure you have given it before you discard the ampules. Incorrect documentation and breaching sterile fields. So these are the main things. These are the common mistakes that can occur during your OSCE. So make sure you are familiar with these before you go and do your OSCE. Remember to subscribe. My next video is going to be nursing in the UK versus overseas, especially Ghana. I hope to see you in my next video. Take care.